or after my next session, and I handed Miss Ollendorf $100. She said, Dr. Reich said the fee will be $50 from now on. So it was a matter of testing to see whether I thought he was valuable enough to pay $100 to. On another occasion, my therapy had been going slowly for about a month. We were in a period of doldrums. Nothing was happening. And he said to me, "You are dead." He said, "How you ever thought you could be a therapist? There's no life in you," etc. He said, "You will never be a therapist." And I was crushed because I thought I was doing fine until then, and I was on my way. And from that time on, I didn't know whether he was ever going to say you can do therapy, you cannot do therapy, until many months later he said, "Why don't you take on a patient and start treating your patient and come in and talk to me about it." And that was hallelujah. I knew I had made it. But he kept people off balance like that in order to keep things moving. He had an anger like no anger I have ever seen. Now, he never demonstrated that to me in therapy. In therapy, he would sometimes be impatient, but he was never angry with me as a patient. But when the group of therapists were assembled, and he would ask us questions or discuss something, and we would not come anywhere near the correct answer, he could get very, very angry. In therapy, he also was very tender. He, like, one had a feeling that one was completely understood and that everything that one did was accepted, except one's trickiness or the kind of thing that superficial layer is. And I'll give you an example of that. I had once read the book Caspar Hauser about a wolf boy who, the growing up of a wolf boy, a feral child. And Reich and I had talked about child development and all the things that can go wrong in child development. So I thought, I'm going to come to my next session having indicated that I read Caspar Hauser, which is a book that most Americans don't read, and he'll be impressed with my international learning. And so I came in and started to speak about Caspar Hauser. And he said, "That's not pertinent." And his look said, "Don't try to impress me this way. That's foolish. Don't be a jerk again in here." And I learned that lesson. So that kind of stuff he did not tolerate. One of my habits when I censored material was to go, which he would always imitate. And when people do that, when that is a big defense mechanism, and when somebody invariably hones in on it, that can be very, very angry-making. So that was one way that, first of all, I learned to stop doing and secondly, to express some of my anger toward him. An incident of the kind of thing that would happen. Once, he had written an article in a journal, and I read the article on my way to my session. And he said, "Did you read such and such an article?" And I said, "Yes." And he said, "What did you think of it?" And I said, "Oh, I was very impressed. I thought that what I learned a great deal, etc., etc. But," I said, "you made some very bad Germanic grammatical mistakes in your English." And he said to me, he said, "I've taken you up in my airplane, and I've shown you vistas that you hadn't seen before. And you say to me, 'Oh, it's a nice flight, but do you know that you put the floorboards in incorrectly? You didn't put the nails in correctly in the floorboards in your airplane? Which I thought that was a way of saying exactly what had gone on between him and me in that session. About Reich's alleged psychosis. The story went around, apparently it started with Fennekel, that Reich had been institutionalized. And everyone declared Reich psychotic when Reich passed the limit of their expectations of him. When the political activists, when he left them and went into the next phase, his political cohort said Reich is now going crazy. When Reich went past psychoanalysis into vegetotherapy, some of the psychoanalysts said Reich is now going crazy. Wherever he went past, wherever people were, he'd gone crazy. And the story persisted through decades that he was in a psychiatric institution. Once, one of my close friends, who was a professor of ophthalmology at Jefferson University, which is one of our best medical schools, said to me, Mort, what do most psychiatrists think of Reich? And I said, most psychiatrists think that he's crazy. And I think most of them think that he's in an institution. He said, no, he said, I mean the responsible academic psychiatrists. I said, that I think they think he's crazy and that he's in an institution. So he was a very methodical man. So he went to the entire psychiatry department at Jefferson Medical School, starting with the professor down through every member of the department. And he said, what do you know about Wilhelm Reich? And they all said he's crazy and he's in an institution. And he said, are you sure? And yes, they were sure. And he said, well, I have a friend who goes to therapy with him in Forest Hills. And they were amazed because they were all sure that Reich was in an institution. So that persisted. And toward the end, Reich had some ideas that have been reported variously as, possibly psychotic. For example, when during one of my sessions, an airplane flew overhead, and Reich said, Eisenhower is interested, who was the president at that time, is interested in our work, and he sends these planes over protectively to watch over us. And I said, I don't think so. I think that's just a plane that's flying overhead as they fly overhead all over. And he said, maybe, but I think that it's protectively. And every time he came out with a statement that other people regarded as possibly psychotic, and every time he expressed such a thing to me, and I expressed an opposite opinion, he did not react the way patients who are delusional react, which is to say, I know that I am right. His attitude was always, you may be correct, but this is what I think, which is not the way delusional patients react when one confronts their delusion. I think that Reich came to such areas because he was a man who was used to thinking in ways that most of us do not think. He took leaps of imagination. And sometimes his leaps of imagination landed him close to heaven, and sometimes his leaps of imagination landed him in a big puddle. But I think that to outsiders, those leaps of imagination that landed him in a big puddle seemed like psychotic statements. And some of them have used that as if to say, he said such and such, therefore what he said about therapy must also be crazy. Which is to say the same thing as Newton had some very queer ideas and mystical beliefs, therefore there must be something unsound in Newton's mathematics. Or Schumann went crazy, therefore there must be something wrong with Renner's symphony. And people use those kinds of illogical arguments when